University of North Texas. And he's been doing some really interesting research looking at surveying patient groups, really trying to advocate for Parkinson's patients in various spaces. And he is in the Department of, was it rehab?
Rehabilitation counseling.
Yeah. And so he'll teach us a little bit about, these concepts within psychology, and just really interested to learn about meaning in life and how we can all get some more meaning in life. So welcome, Brad. Thank you for joining us today. Tell us a little bit about your background, because you have sort of an interesting background. You are you came a little later to this aspect of caring about Parkinson's patients and studying psychology, right? You had a different sort of career before this. So maybe teach us a little bit about that briefly, and kind of what inspired you to care about Parkinson's patients and sort of your sort of current job and your passions.
Yeah, well, thanks for having me first, Indu. I appreciate it. It's always fun to talk about this stuff. Those of us who do the research, we get excited about the things that we're doing and the things that we find, and it's always fun to share. So thank you for having me. So a little about me. I spent almost 20 years in the pharmaceutical industry, in sales and in different levels with a variety of companies. And about 8 or 9 years ago at this point, my mom was diagnosed with Parkinson's. And I had gotten to a point in my career where it just I didn't have any meaning, right? Let's put it that way. I didn't enjoy what I did. I was on the road all the time. And I said, I want to find something new. And I realized at 40, probably that time, 43, 44, a little old for medical school to go back and do all of that to get done. And I thought, well, PhD is a reasonable route. And I kind of serendipitously fell into this rehab counseling / rehab psychology world, and realized it's about working with people who have chronic illness or disability, and how can we help them adapt to their new way of life? How can we help them deal with these challenges that they're beset with immediately, right? You walk out of a doctor's office with a diagnosis of Parkinson's disease, and in your mind, a lot of things begin to change. There's a lot of fear, there's probably depression, there's anxiety, all of these things. And how do we deal with that? And that was kind of the impetus for me. I watched my mom, asking me questions. And at the time, probably like most, you think, my mom was 67 at the time, and I thought, she's really not that old. Parkinson's is an old disease, right? That's kind of what the world has thought for so long. And so I'm learning about PD, and kind of just really got connected with some really great people who have helped guide my career, get me into this world, and kind of fell in love. I'm a pretty avid reader. And I read a book called Man's Search for Meaning by Viktor Frankl. He's a neurologist from Vienna, and he was a Holocaust survivor. He was in Nazi concentration camps, lost his whole family, and developed this counseling intervention belief called logotherapy. And it looks at, if you have the right perspective, and if we look at things the right way, we can make it through any challenges that we have in life. And his was the ultimate, right? You've got a guy who's in a concentration camp, and he lives for years while he's in there. He actually flourishes despite the challenges. And so I began seeing that, and I thought, how can we incorporate this meaning, purpose, positive psychology? It's all kind of under the same umbrella into the world of Parkinson's disease. And that's kind of where I'm at. I came in, and we'll talk a little bit once I pull up the slides about positive psychological capital, which kind of all falls together. But it's looking at these positive resources that are all part of who we are, and how do we cultivate them more. So that kind of gets you up to speed with where I'm at.
Yeah, I love that book. That Viktor Frankl book is probably one of my favorite books, and I had the actual great joy of meeting his grandson at a meeting. And had his book in my car, and I never take notes in books, and it was the most annotated note taken book I've ever read. So it's very short. So definitely a must read. Maybe we can link that in the chat. But yeah, without further ado, because I know you also had this exciting paper that just came out that Mike Oken had been tweeting a little bit about. And so I know that there's been some interest from our patients as well. And I think, what we really try to bring to folks in this series this holistic series that I've been trying to help guide here with the PMD Alliance is really sort of practical tips. So what can we really do to help our patients and their caregivers as well? Because I don't want to forget those folks. We've had some conversations about helping caregivers find meaning and purpose as well, which I think it's important for each and every one of us, even as healthcare providers. And it sounds like you yourself have sort of had a career realignment around your own sort of thoughts. And so it's not just talking in theory, it's really, you speak from a place of having really realigned some things for yourself. So maybe I'll let you share your slides and then we can kind of chat around and we can, have some audience sort of questions as well in the chat. We'll sort of man those.
Can you see these now?
Not yet.
Not yet. All right. Let me go back and go to share. There we go. All right. There we go. Now we good?
Yep.
Okay.
Yep.
Perfect. So, when Indu and I talked about what this was going to be about today, she had the idea, which I think was super, to talk about some definitions, some of these words that we hear flying around all of the time, the buzzwords, right? Positive psychology is the big thing, and quality of life. So I thought I would just spend a little bit of time going through what these things are and why they matter and why they make a whole lot of sense, and not just with PD. There's been a little chatter in the Twitter world about what I'm doing and making the assumption that people with Parkinson's disease automatically lose meaning in their life, and that's not at all what I'm saying. I think that we talked about that a second ago, regardless of where we're at in life, we have struggles that we go through, and it's about how do we navigate those most effectively. So you've probably all at some point heard positive psychology. It began long before it ever became vogue in the medical world, and really back with Viktor Frankl was the, if you want to trace it all the way back to him. Abraham Maslow was another one who you've probably heard about, Maslow's hierarchy of needs, that looks at where do people fall on this continuum of the things that they need in life to be able to function. And really what it is the study of optimal human functioning. It's what are the things in our life that make life worth living, and what things lead to happiness, fulfillment, joy, peace, all of those things. That's kind of a really broad definition of what positive psychology is. And in the field of rehab psychology and rehab counseling, that begins with a woman named Beatrice Wright. And she was at the forefront of the positive psychology movement back in the 60s, 70s, and 80s. And she began to talk about what happens when someone has a chronic illness or disability, and how their values in life can potentially change. And how do we change a focus from those things that we've lost to what we're left with, and begin to focus on how do we move forward, and how do we cope positively versus succumbing to the illness that we've been diagnosed with. And those things are essential for allowing one to remain active in life, not end up with a lot of depression, anxiety, apathy, all of the things that those in the Parkinson's world hear about regularly. And again, it's not just PD. It's if we lack these things in life, we tend to have some challenges. So positive psychology was developed really in the late 90s. Martin Seligman was a psychologist who coined the term, really, positive psychology. And so we began looking at how can we interact, how can we influence things in someone's life to help improve quality of life. Quality of life's a big outcome that we study a lot in these, call it the soft sciences, right? In the social sciences. And it's really just a subjective sense of well-being. How do I feel about my life? How do I evaluate the things in my life? How's it going? And, some of it's objective, whether or not you have a job, whether or not you're married, those things we can measure and we can check yes or no, a dichotomous variable, versus these subjective things of, do you feel like you have a good quality of life? That's a valid measure. It's very difficult to quantify that, but we certainly, we take that into consideration. So it's important as we kind of talk about this, that's really my end goal with my research is how can we improve quality of life while we wait for a cure, right? In PD. And, you follow what's going on in the literature and where we're at with the etiology and what's the deal. Things are changing and we're hearing different voices out there, and don't know when a cure is going to happen, but let's try to see what we can do in the meantime. The other term that I'm very interested in is apathy. I've seen it with a number of people, and I really enjoy having conversations with people who have PD. I've got some really good friends who have young onset Parkinson's disease, and we talk fairly regularly about their experiences and what they deal with. And we know from the literature, and we also know just from talking to people, that apathy is a big deal. But what is it, right? How do we define it? And it's really a challenging neuropsychiatric syndrome because it overlaps with depression and anxiety, and sometimes you're just not really sure which it is. And it's really just a loss of goal-directed behavior and motivation. So someone who just decides to stay home and watch TV rather than going to a support group, rather than going to exercise, rather than going to PT, even though they know those things are beneficial, but you just can't get motivated to go do it. And, the literature is very broad with what you see as the prevalence of apathy. You can see up to 70% in some studies, but I think the average 35 to 40% is fairly reasonable. And the interesting point to me that I found was there really aren't any great treatments right now. We have some things that the movement disorder docs will try, and it seems like it's trial and error. Some things work, some things don't. But we also know it's one of the top 5 factors negatively affecting health-related quality of life. So clearly, it's something that needs to be addressed and evaluated. Can we find some kind of an intervention that can make a difference there? So, and that's the area that really interested me at the beginning. So the last definitional piece that I have here is Indu mentioned at the beginning. I learned as I was a doctoral student at the University of Kentucky about this idea of positive psychological capital, and it's a framework that was developed in the business world, actually, by a guy named Fred Luthens at the University of Nebraska. And what they found was people who score higher in this construct, and it's made up of hope, efficacy, resilience, and optimism. And if you score higher in those things, you're a better employee. You're able to be managed better. You have better production. You come to work. You're good to work with your fellow workers. All makes total sense, right? If we think about those characteristics, but nobody really looked at it in the medical world. And I thought, well, we know the effect of resilience on people. Literature's clear. Self-efficacy. Bandura talked about that a lot. And so we understand that that's an important characteristic. And the same thing with optimism and hope. So looking at these positive personality states, you have states and traits. These are considered states because they're malleable and they can be changed with interventions. And that's the important piece. We have the big 5 personality traits that most of us, you may have heard about in the literature, right? Narcissism, agreeableness, extroversion, introversion. Those things are largely part of who you are. And frequently you can move them a little bit, but they're really not changeable. And so I began looking at positive psychological capital. It's what I wrote about in my dissertation. And so we finally decided that the only way that we can make this construct usable in the world of people with PD is we've got to validate the measure. They've had a couple of measures that have been used. They've got a 24 question measure and a 12 question measure. And so we used a group of patients with Parkinson's disease, and we did some factor analysis on the positive psychological scale and said, you know what, it works in people with PD. The only thing that we saw there are some negatively worded items. And anytime you have negatively worded items, they can be confusing to people. And especially if someone has any cognitive decline, they sometimes have difficulty interpreting what the question is asking. So with our final model, what we decided was we had to take out those questions that were negatively worded, but it still was valid. And that was a big deal to be able to say that. And so now I think we have a measure that can be used to say, do people possess these things? Yes or no? If they don't, what do we need to do to improve it? And we'll talk about meaning in life in just a minute. But the great thing to me is about the pieces of PsyCap are that they can all be affected by improving meaning in life. So you're gonna kill two birds with one stone. You're gonna get the benefits of having meaning, but you're also going to improve these 4 factors that I believe, without a doubt, are beneficial in PD. And we'll do some research moving forward to talk about this. But so kind of that was a little bit of background about how some of the terms that I've used, some of the things that I've worked with. And so now the question becomes meaning. What is it? Right? It's kind of this esoteric thing. And you say, is it meaning of life? And I don't know what that is. And I don't really know what it is either. I think that we all have an idea of why we exist. What are we here for? What's the grand plan in the universe of our lives? And that's not something I'm super interested in from a research perspective, because it really can't be researched. There aren't any ways that we can quantify that and look at how one person believes versus another person's belief and what can we do with it. So my interest is really more in meaning in life. What is your life? What are the things that make your life worth living? What are the things that excite you? What are the things that give you purpose? Those things can be changed and those things can be measured. And when we think about what things can give life meaning, these are at the domain level. And the 2 big ones that we see in all of the literature are work and relationships. For many people, those are the 2 highest ranking domains of meaning. And interestingly, when you look at an older population, just the general population as we age, and you retire from work at 65, 70 years old, we frequently see problems begin to occur in someone's health. Many people, that's been their sole purpose in their life, has been their work. Now, all of a sudden, they begin asking, who am I? What's my purpose? I don't feel like I'm significant anymore, and begin to have health problems as a result. And so those are things that I believe are important to look at when it comes to quality of life in PD and apathy in PD, quite frankly. And then the last one really is the fluid meaning. How does meaning change when I go through a really challenging time in my life? I have this season where I had a car accident and I've now got a disability, or I've been diagnosed with MS or PD. And now everything in my life, I'm reevaluating what's going on and what am I going to do moving forward and how am I going to address this? And, so you get to that point. We talked a little bit previously about Beatrice Wright and looking at coping versus succumbing. Do I move forward, lean in, and work towards becoming something and not focusing on my disability? Or do I just kind of give up and say, you know what it is, and we'll see what happens? And clearly, the best option when you get to that point is pushing forward and saying, what can I do with the abilities that I still have? And how can I take what I've been given in life and help someone else? Because we know that helping relationship is a huge positive influencer on people's quality of life. And we know from research that traumatic life events can negatively affect meaning in life. It's really not even debatable anymore. The research on meaning 10 years ago, there wasn't a lot. There was still a lot of ambiguity around the construct. Even trying to define what it wasn't clear. In the last 8 to 10 years, there's just been an explosion in meaning research. I know that just earlier today, I did a Google Scholar search and looked at how many articles were in there from 2021, and I think there were 111,000. You compare that to do a search for Parkinson's disease in the same time, and you're looking at about 25,000. Quality of life is about 110. Those are big numbers. So clearly people are doing research, they're writing, they're publishing because there's something there. And it's really fascinating. So I don't know, Indu, if you've got things that you want to jump in, feel free, or I can kind of keep going.
Yeah, no, I mean, I think that people are definitely, it's resonating what you're saying. There has been a couple of questions about, just already about one of the things was whether if people have more means and privilege, whether that makes their capital more is a question. And I think we've been talking a little bit about, are some of the things that we sort of sometimes have to help people only accessible to a very small population of folks, such as we talked about, cognitive behavioral therapy and things like that. So we're hoping, definitely in this, the remainder of this chat to definitely find practical things that all of us can do without having to hire, a psychologist and pay one-on-one sort of fees for that. So
for sure.
And then YOPD is young onset Parkinson's disease.
Okay. Sorry, I didn't define that clearly.
Oh yeah, no worries.
But yeah, those things that you mentioned, Indu, there, the psychological capital was really an extension of the human capital of what I know, or the social capital of who I know. And PsyCap is really who I am. Who are you as a person? What makes you up? What gives you, what's the internal drive that you have that makes you a good spouse, a good employee, a patient who's pursuing all of the options that you have at your disposal to improve your condition, right? And the question, and Indu, you and I have had this conversation over and over, it's kind of the so what in research, right? We do all of this descriptive research and we say there's a relationship between X and Y. And that's great that we show that, but we need to move forward and say, so what? Can we change it? If we can't change the relationship, it's tough, because you go, what do we do with that? And that's the great thing that I believe about meaning in life, and PsyCap for that matter, is that there are interventions that can be used in the doctor's office. It's something that a movement disorder doctor can talk to their patient and say, here are some things. And I've got a slide that we'll get into that you don't need to go see a therapist. That there clearly are interventions that are available for meaning in life, and they're validated, they're very good. But it's largely CBT based, or existentialism, which is the whole realm of where meaning in life comes from. Those types of interventions, and those are available as well. But I like the practicality of being able to have, you've seen your patient in your office, or you're seeing your doctor in your office, and you're at the end and they say, do you have any questions? And you talk about this. And a movement disorder doctor can say, here are a couple of things, X, Y, and Z, that you might consider trying. And you go home and you try them. And then you kind of reconvene and talk about how that went. And that's the ideal situation to me, because it is tough when you say, I go see a counselor and have, 8 weeks of CBT. There's an expense associated with that. And it's also a struggle for many people to do. So those are great questions that we'll have answered before we're done here. So as we go into, I talked a little bit about where we were 10 years ago with meaning and where we're at today. And probably the foremost thought leader in the world of meaning in life today is Michael Steger. He's at Colorado State University. He's a social psychologist. He's written a ton of articles, and he and Frank Martela, who's from the University of Helsinki, they've done some work together trying to look at this triumvirate of what makes up meaning in life, the tripartite, if you will, look at meaning. And these things have been pretty well validated and they're pretty well agreed on in the literature that significance, coherence, and purpose are the three components, that the three evaluations, if you will, that somebody makes about their life to determine whether or not they have meaning. And so we think about significance. Does my life matter? Do I have inherent value? Is my life worth it? Do I really make a contribution to society, to my home life, to my work life, right? So that's an important thing for people to consider. The other piece is coherence. The degree which people perceive that their life makes sense. Do I understand myself in the context of life? You know, you may have this overarching belief about what the meaning of life is. Does the way that I'm living my life day to day fit with that belief that I have about the meaning of life? If they do, then you have coherent life. If they don't, you've got conflict, and you're probably not going to have a meaning, and you're probably going to struggle with some outcomes in life. And the last one is purpose is really if there's one of them that's still kind of a struggle between different researchers, it's probably the purpose piece, because oftentimes meaning and purpose are used interchangeably as the same word. And they're really not. And particularly if you look at the way Viktor Frankl talked about the words, he had different words in German to mean purpose and meaning. And looking at what those were, he had a delineation between those, that purpose was based on some highly valued goal, something that I was pursuing in my life that gave my life meaning. And I think that makes a lot of sense. I think that, you know, we think about, and I talked a little bit about retirement. You know, you see that I've got a dad who's very type A personality, and he retired very young and keeps going to other jobs. And I think that's kind of his sense, not just of purpose, but of significance as well, that we seek these things in life. And it's critically important that how we answer each one of these components to give us this overarching understanding of, does our life have meaning? And if it doesn't, the nice thing about breaking it down into these three is that we can begin to establish interventions to focus on which one of these areas someone might be struggling with. So you're struggling with a purpose, and we go, okay, let's talk about that. What are the things that you enjoy doing in life? What are the things that you feel like you've been gifted with and you are just passionate about? How can we find a way to have you involved in that, to where you feel like it's something to get out of bed for every day? Is probably a really nice way to put that. And, you know, probably many of you on here have experienced that at some point in your life. You found a career, you found a hobby, you found some friends, you found a spouse that you felt like gave you that sense of purpose in your life. And that's really all this is beginning to ask questions. If you don't have it, let's see if we can figure out some places that we might find it. And really, it's just a matter of introspection, asking yourself those questions about, what is it that I care about? What do I value? How do I feel about me? Do I feel like I matter? If I wasn't around, would people even notice? And those are the types of questions that begin to be evaluative of one's meaning in life. So why do we care? Why am I even talking about meaning in life? Does it matter? It clearly does. Thousands of studies have been done on what are the benefits of having meaning in life. And more positive emotions. People who have higher meaning in life are happier in general. Positive personality traits. They have more friends. They do better at work. They're more outgoing. Just better life satisfaction in general. Self-esteem and self-worth. Positive coping skills. Hope, optimism, resilience, right? We talked about that with PsyCap just a few minutes ago. Better health-related quality of life, well-being, successful aging. I mean, you name it, and anything positively that you could look at is highly associated with meaning in life. And it also has some pretty significant health benefits. Has lower physical decline and slower cognitive decline among older adults, decreased PTSD, lower blood pressure, less negative affect, less depression, less anxiety, so on and so forth, right? We can continue adding to this list really ad infinitum. But the purpose, the reason that I show this, it kind of, it begs the question of how are we going to figure out how to implement meaning research into the lives of people, particularly as we're talking about PD, right? How can we sit down and say with patients and with friends and family members, let's look at these areas of your life. Are you struggling in a given area? Do you have, have a lot of negative affect? You're down, you're depressed, you're anxious. Maybe a way to treat that is improve meaning in life. I believe it is. I believe it's one way. Let's put it that way. It may not be the only way. SSRIs, SNRIs clearly work and they're effective. So kind of the end of the day, right? This is, Indu has the phrase, the secret sauce, right? This is what it's about, that thousands of studies show that people who have meaning in life are happier, they're more fulfilled, they're more fun to be around. People like them better. They have more relationships, they're healthier, and they live longer. I mean, that's a pretty good list. I would sign up for that list if you could give me something that made all of those things happen in life, right? So to me, it's kind of a logical step that we go, all right, how can we harness this thing, meaning in life? And how can I bring it into my life to hopefully help me move toward these positive outcomes? And that's kind of the $1 million question, right? We've shown that it works. We know it's effective, but how do I find it if I don't have it? So we got to figure out what are the sources of meaning in life. And there are a lot of them. There have been multiple papers that have been written looking at these things, but clearly there's a large distinction between work and relationships and everything else on that list. Those are the two most important things. And, one of the things that makes sense to me is, the paper that Indu published a year ago about isolation and COVID. When you lack that interpersonal relationship with other people, it has negative outcomes. We know this. There's no doubt about it. All of this data that's come out about, the lockdowns and the social distancing and what that's done to depression outcomes, suicidal ideation, substance abuse, all of those things have gone up in the last 18 months in every patient population. And so we know that these interpersonal relationships are critical. And how do we find them, right? And the challenge is frequently we find these at work. That's a place where many of us find relationships. You spend eight hours plus a day at your work. And if you're not working, then it's like, where do we find those things? And it's different for everyone. Is there a spiritual connection that someone has, that you go to church and you're affected, meet those people? You go to support groups in the community and you develop friendships there. People who understand you, what you're going through, who have been through where you're at and can help you. And the interesting dynamic when thinking about relationships is one of the great ways to improve meaning is the altruistic way of, am I working to help other people? And that's the essence of support group meetings, right? Can I take someone who's newly diagnosed with PD, who walks in, who's scared, who doesn't even know what the next step is, and walk them through my story? This is what happened to me. This is when I was diagnosed. And regardless of the fact that this is a very heterogeneous disease, there are some common fears that are found at the very beginning of diagnosis. And, we grow when we help others. And so support groups is a great way, but you look at the rest of that list and you say with a patient, what on this list do you really enjoy? Do you have a hobby that you like? Yeah, you do woodworking. Great. How can we spend more time doing the things that you enjoy so that it becomes something that's having value in your life? And that's the ultimate question. And these are the simple things to do. How are things going in these areas in your life? Are they not good? Are you spending time actually doing any of these things? And the time value exercise, right? You take a sheet of paper and you fold it down the middle. And on the left, you put all the things that you've been doing, how you've been spending your time. And on the right, you put the things that you value. Open it up and you look at it. Do those things match up? If they don't, there's probably some adjustment that can be made, because ideally is I'm going to spend time investing in doing the things that I have value in my life. Allocate more time to the things that I enjoy, the things that I believe are meaningful in my life, the things that might give me significance, purpose. Do more of it, right? The solution focused therapy mantra is, if it's not working, stop. If it is, do more of it. That seems very simple, but if we evaluate these things in our lives, I believe that we can begin to work more toward that. The collaborative component, teamwork, that's the patient group together, the support groups. Do I have people in my life who I can talk to and invest in and learn from? Share experiences is the fourth bullet point there. That's been shown to increase meaning in life. And lastly, help others foster meaning. Once you begin to learn this process, it's fairly simple to begin to talk about it with other people and say, let's talk about where you're at. What do you enjoy? Are you doing that or not? And how can we cultivate more of it? I think this is the last one, Indu. So this was kind of leading into the research that I'm finishing up right now, looking at meaning in life and apathy, among other things. What we know from the data right now is meaning in life negatively correlates with, which means if meaning goes up, these other things go down. Apathy goes down, loneliness goes down, depression goes down, anxiety goes down, health-related quality of life goes up. And this is in Parkinson's patients in particular. So this is really the first time this has been addressed in this patient population. And there are some interesting things that I think we're going to find. We've got very similar research looking at young onset Parkinson's. I suspect that we'll have the same findings in the young onset group. And it's fascinating, because it would be really, really great for the community as a whole if we could find that meaning in life had these really simple micro interventions that could improve it. And if that could bring down apathy, if that's all you got out of it, that's a pretty great thing. Increase quality of life, improve that. Yeah, those are great things. They don't have to be something that cures the disease, but can I make someone's life a little bit better with increased meaning in life? And that's kind of where I've gotten to in the research. And I'm excited about it. And I think that we'll have some interesting things coming out very soon that will be able to talk about this stuff and bring other people in who are interested, other clinicians who are studying similar things. And how can we put our heads together and say, what's next? What do we need to do next? And so Indu, that's it for the slides. And we can, if you've got questions, if you've got stuff you want me to talk about, I'm happy to do it.
Great. I think that was a really good, overview, defining things as well, because I think it gets very confusing. People start reading some of these papers and are like, I don't have no idea what these words even mean. But I think some of the bottom line is, that this is a very, sort of exciting field now, not just in Parkinson's, but aging in general.
Yeah.
COVID has really shone a spotlight on the importance of some of this, I think, for all of us. And I think when we're sort of, faced with people who are, dying in front of us and limited resources and, world that's sort of been turned on its side, I think a lot of us start to sort of think about these things. So I think it's sort of one of these things where we're really trying to reorient and see what we can do in a practical way, to help each other and help certainly our patients and the caregivers as well. So so I think that, a lot of what you said has resonated with you. The social connection obviously has been something that's been a passion of mine. I think that's something that, is a very simple, tangible thing, is if you're very lonely and very isolated, if there's ways that you can start to try to change that. I think being on a support group like this is sort of step one, but there may be people who couldn't join the support group that in your communities. If you can try to, reach out to them. It sounds like volunteerism and helping other people is another big piece of this. And so I think that's, sort of some low-hanging fruit as well. In the chat, just sort of some of the things that have happened, happen to be written in the chat here. Some of it's around caregivers, actually, and the sort of limited time that caregivers may have, sort of helping caregivers feel like they can also have some purpose and meaning when some of, they may have had some of these things, ducks in a row. And then, being a caregiver has sort of changed that focus. Are there some practical things that we can maybe just talk about from a caregiving perspective? And one of the chats that we had earlier, and it's archived, is Megan Gomez, who is a psychologist whose grandmother, I think, or grandfather was a Parkinson's patient as well. And she actually, really put a lot of emphasis on being a caregiver as a meaning and purpose. And so maybe you can speak a little bit to that as well.
Yeah, I think that the same research that's being done in patients with Parkinson's disease, clearly we could benefit from doing that research in people who are caregivers. I think, unfortunately, and again, I look at my mom and my dad, and I look at the things that my dad has involved with my mom currently, and I don't think that he's asked by any of the doctors that he goes and sees, Wayne, how are you? How are you holding up? What's going on in your life? We clearly have movement disorder doctors who ask those questions. And it's certainly something that I believe is critically important to inquire, because it's kind of the thankless job sometimes, I think, that you drive them to appointments, you get them to these things, you help them do this, and kind of the what about me? And it's absolutely, I think the same interventions work with a caregiver or with a patient or with me or my wife or anybody else who's saying, I'm wanting to find more meaning in my life. How do I do that? Here's the thing. Let's just sit down and have a conversation about what's important to you. What do you love to do? And I think one thing that I believe is critical for caregivers is having time for you, right? Some me time. Because frequently it can become very overwhelming, depending on the person whom you're living with, your spouse, your significant other, where they're at in their physical and cognitive abilities at a given point in time. But it's important to find that for you. The person that you're working with, absolutely, that can be part of your purpose in life. Because I said, I love you, I'm going to take care of you. But I think there also needs to be that time where you get away and you recalibrate. And you say, I enjoy walks in nature, and you go do it. And that's kind of the thing that you do every day, or into like yoga, meditation, mindfulness, whatever it is that you find that you go, wow, that's my happy place, that I just want to go and refuel my batteries and come back so that I can be as good as I need to be for whomever it is that I'm working with. But yeah, I think that's always something that I think we neglect as researchers to ask questions about enough, is the caregiver side. And, hopefully we can begin to move that needle and specifically address caregiver issues and how they're different than the patient. So great questions. And I think, like I said, the interventions are largely the same.
Yeah, I mean, I think it's a huge area that is unmet. And, we as clinicians we can't bill to see that the healthcare system is not set up to provide good care for caregivers, which we know an engaged caregiver, as we talked about with Janice Miyazaki last month as well, is so important in the success of our patient care. So one of the most important people in the treatment paradigm is kind of neglected by the current healthcare system. And we sort of have to find ways to change that. I think Heather Kennedy had wanted to say something about their program, if that's okay, Brad.
Please.
Maybe give you a moment. Heather, Andrea, you can maybe spotlight that person.
Hello, I wanted to just give you props and Brad props. Thank you very much for being here, and Andrea and everyone who's making this happen. We need you in our community because this is one of the largest topics, hands down, that nobody is talking about. Thank you so much for bringing all this up. I appreciate you so much more than I ever imagined. The reason is our lives are enriched by knowing that we have a purpose. It is absolutely vital that we not only have a purpose, but that we feel supported, that we know how to ask for support, that we have something to look forward to, and that we stay in communication with others, both others who have Parkinson's and others who do not. I was diagnosed approximately, 12 years ago. I can't, math's tough. But I think I've probably had this about 18 years looking back on symptoms. And one of the things that makes me tank, makes me suffer even more, is when I disconnect, is when I stop engaging, is when I lose my will to help others because I think, well, I'm so much in pain, I just need help. Nope, where we're wounded is where we can be brilliant. Where we're wounded is where we can help others. So no matter how down you feel, I implore you to reach out and to think about things that you could do to just give back, even if it's something just like making a phone call or typing a really quick note. Hey, how are you? You know, picking a flower, taking time, just like Brad suggested here, like Indira suggested here. Thank you so much for this group. This means a lot to me that you guys are doing this. It means a lot. Thank you.
Thank you. Thank you. You guys have been great. And I know that Gavin's also joining us. And I think, there's, some great advocacy work that has, I know, sprung from sometimes, finding, realigning meaning and purpose, and then sort of then trying to help others. And I think, again, the models of how we can help disseminate some of this information, mentorship, maybe having a buddy, a Parkinson's buddy, or someone that you can check in with, coaching, different sorts of models. I think we sort of have to be a little open-minded to some things. I don't know, I think John has his hand up too. Maybe we can have him speak for a minute, Andrea, if that's okay. And then, yes, one of the other things that's been resonating a little bit in the chat, maybe Brad, you can speak about this after John, is sort of just giving ourselves permission sometimes to do the things that we actually enjoy as caregivers, as healthcare providers, as people living with Parkinson's as well. Sometimes I think so much of our American or Western ideas of how we need to live is like making money and doing a job that might be mundane. And then, when we get into sort of spaces where we have choices, we feel a little bit indulgent in trying to actually do the things that we, I love spending time with my grandkids. Well, why do you only do it once a month then? Or I love, going to the movies, or, going for, a glass of wine with a friend. Why are we so, sort of, hesitant to do the things that we really do bring us joy and that we look forward to, is a question that I have, even for myself sometimes. So we can be a little bit more open-minded to that. But maybe, John, maybe you want to say something?
Yeah, just quickly, what occurred to me not long ago was that I am a caretaker for my caretaker. So that's part of purpose of life, is I have to take care of my caretaker. Another thing I've gotten involved with, I'm a techie, and one time at the doctor's office, when I was asked the usual opening question, which is, how you doing? I said, I'm doing fine, but you probably should ask my watch. It occurred to me that the data that's collected by devices that are available these days can be really useful. And I actually did use data to adjust the dosing of my nighttime meditation to flip two meds, one from 10 o'clock to 11, the other from 11 to 10. And it made a big difference in my quality of sleep. And the final thing I'll say is that I'm currently searching for something to aid in acting out dreams. I have a problem with getting violent in the middle of the night, and my wearable system, my devices actually can report it. I mean, I can see it in the data that I've had an episode, but I can't figure out how to get somebody to wants to put this together in an engineering way to use Alexa to wake me up. Sorry.
Okay, no worries. Yeah, thank you for those. So it sounds like everyone's trying to, use their sort of experience to come up with some new and creative solutions. I think creativity is sometimes awesome too. So I think one of the things that we don't have a lot of time here left, but Allison here says that maybe referring patients to a social worker, possibly a psychologist as well, can help with some of this. For the patient, sometimes the caregiver and the patient, and I think these are things that certainly can be helpful as well to find some of these meaning and purpose. But getting back to sort of giving ourselves permission to maybe do some of these things that bring us joy. How do we help ourselves to feel like that's allowed?
Yeah, and that's, just comment quickly. I'm a firm believer in psychologists and counselors. I think no matter who you are, wherever you're at in life, they're beneficial. So I'll leave that at that. But giving permission. And I think that, there can be the guilt associated with my taking the time to do something I enjoy, taking it away from someone else, my kids, my work, fill in the blank, right? And for me, I think the way that we can most effectively deal with that is to say, for me to be able to function at my best in these situations, I need to be well. And to be well is again, that's a really broad term. What does that mean? It might mean that I just need to go take a walk once a day by myself. I need to do yoga. I need to meditate. I need to, whatever it is you enjoy. And I think it's about shifting the perspective, about saying, instead of taking time away from them, that, I'm taking the time to improve my ability to interact with them, that, right? And it just makes me better as a person and as a caregiver and just someone who's in a relationship, that I'm more capable of being calm and responding rather than reacting, which when we're in that stressed out state, we tend to just react and things go south. So it's about personal care, right? My health hygiene that I have to take care of on a daily basis.
Yeah, so I think this giving back sort of sense, helping others definitely. And I think if you can recharge yourself or fill that fuel tank, then you can give in more ways, whether that's as a patient who is living with this or as a caregiver too. I mean, just taking that time for yourself and even our healthcare providers. I think many of us are facing burnout and, sort of giving permission to, take some time off. We feel bad as a society sometimes to take vacation or to take a break or to sleep in sometimes or, not be perfectionists in every way. And so much of what I've been helping my colleagues do is just sort of give permission to not be perfectionists and, sort of take some time. So I think we could all use this, not just, people living with Parkinson's. So thanks so much. I think a lot of this is very, very applicable to so many. And that book is amazing. If there's any other books, Brad, I think people have wanted to know if you have a book, but I know that we've talked about writing a book on some of this stuff or a workbook. I think those are we'll see where all of this takes us with some of these conversations. But is there a practical resource or two that you could link or something that you really think is a good place to sort of have our patients and their caregivers maybe take a look at currently?
Yeah, let me send you something that would be a good link. There's a guy named Paul Wong who's emeritus professor up in Toronto. And he was the meaning guy for a long, long time, still is very well respected. He's done more research looking at the interventions to improve meaning than anybody else. If I talk to Crystal Park in Connecticut or Mike Steger, many of them are saying we just don't have the bandwidth to take on the intervention piece. We're still talking about the descriptive research piece. And so I think Paul Wong has some really good stuff. He's an interesting guy. He's very involved in spirituality, and which is a whole nother topic. We could spend another hour on what role that plays, right, in meaning in life. But I'll send some stuff to you, Indu, and you guys can figure out how to link that up.
Perfect. Yeah. If you send it to me, I'll send it along. So, well, this hour literally flew by. We have maybe a couple of minutes just to kind of wrap up. Brad, do you want to say, sort of something, some exiting sort of positive psychology kind of cheerleading stuff that
Yeah.
we can kind of say goodbye around and sort of inspire people to do some cool things in this space.
Yeah, say something profound. That's what I heard. Yeah, that's always great. But listen, meaning in life, finding meaning in life is up to you, right? It's a personal choice. And if we want to improve it, there are things that can be done. And if we don't like the situation that we're in, our current circumstances, the question is, what do I do about it? What am I going to do tomorrow that I didn't do today to make it better? And I think, to me, that's kind of getting this all widowed down to a nutshell. It's, I have a choice, and what do I want to do? So I'll leave it at that.
Sounds good. Well, you heard some, very, I think, low-hanging fruit today. Social connection sounds amazing. If there's somebody that you can help, try to help them, even if it's something small. I think that, volunteering, even many people have had careers, and I think they still have so much to give. And so if there's someone that you can help, that you can kind of look out for, I think it can really bring tremendous meaning. And so, yeah, so we'll wait to hear kind of, in the future, kind of where we get. I know that you and I are publishing a paper or two around this. And I know that you also have some surveys that are possibly going to be posted. So maybe we can link any of the things, your current studies as well. So people can, sometimes participating in research studies is a good way to find some purpose as well. So anyway, well, thank you so much, PMD Alliance, for hosting. Thanks for, some of the other comments that were in the chat and some of the folks that spoke up. And Andrea, I'm going to pass it back to you for our exit wave goodbye.
Yes, we always end Dr. McDaniels with a little goodbye wave of gratitude. So I invite everyone to turn on your camera, stretch that heart across the airwaves, and make some send some good vibes. So thank you, Dr. McDaniels. Thank you, Dr. Subramanian. This was an amazing hour. Thank you to everyone who had questions and feedback and sent those a lot of meaning in the chat. So thank you, everybody.
Well said.
Bye, everyone.
Right. Thank you.